Hi everybody, this is a video about multiple sclerosis. Just before jumping into the content of the video, if you wouldn't mind taking a quick second to like or share or subscribe or post a quick comment, I'd really appreciate it. So thanks in advance for taking a second to do that. So someone posted the question, what are treatment options for someone with MS? Also known as multiple sclerosis. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So when it comes to an MS diagnosis, there are, of course, some pharmaceutical, like we'll say conventional medical treatment options. Most of those options largely revolve around trying to throw a monkey wrench in the immune system elements that are actually driving that autoimmune process that's demyelinating the nerves in the central nervous system and ultimately contributing to those MS symptoms. There are, of course, also some other conventional medical interventions that can be used to treat some of the side effects, or not side effects, but the symptoms of multiple sclerosis, like perhaps using muscle relaxants or things to help address some of the visual changes that can occur, or bladder changes that can occur with more advanced stages or during certain episodes of MS. But in addition to, or as a complement to those therapies, or for some folks, they don't necessarily need to use those pharmaceutical interventions, depending on the case. There are a number of things to consider from a more functional medicine or integrative medicine or naturopathic medicine, whatever term you want to use, to help folks in that regard as well. Now, one thing that is important to note is that folks who have quite progressed MS, like where they've already developed things that progress to the point where there's quite severe symptoms, it can be really challenging to gain much ground. In those cases, where I usually set the bar is for, like, let's do what we can to try to either slow further progression or at least try to stall things out where they are. But in terms of actually regaining lost ground in really severe progressed cases, it's quite a tall order and can be very challenging, if not impossible, to achieve that. I have seen some benefits I have seen some lost ground regained in severe cases, but it's more the exception than the rule, unfortunately, and that's just my experience. Now, maybe if a person was able to access stem cell therapies or the right types of peptides or different things that are, quite potent interventions, maybe the playing field changes, and we don't have access to those things in Canada, and just it's quite challenging for patients to access those. They usually have to go out of country, and it's quite expensive. However, for cases that are more mild to moderate, the things to consider, or that I consider, are there any chronic infections afoot, especially with the Lyme disease causing bacteria, Borrelia burgdorferi. There's some interesting published evidence looking at a link between Lyme and multiple sclerosis. That's definitely something that I think about. There's also some research literature looking at the benefits of high doses of vitamin D. I've posted other videos about vitamin D receptor resistance, which is something that I'm now screening all of my patients, if they're willing and able to do it. Screening my patients with MS and other autoimmune conditions for vitamin D receptor resistance could be a very important component of that protocol. High dose vitamin B12 can also be really helpful and important. And then making sure that we're supporting the mitochondrial function. It's important for pretty much any chronic health, for every chronic health condition that's out there, but it can be especially important with MS. And then also working with certain antioxidants can be really helpful, notably alpha lipoic acid and glutathione can be really helpful to bring into the mix. In addition to looking at Lyme, like Borrelia burgdorferi, as a possible causal or contributing factor for MS. Also thinking about possible virus involvement too. There's been, maybe a year or two ago, there was a paper that came out basically, for all intents and purposes, saying that Epstein-Barr virus seems to be the cause of MS, or at least it's the straw that breaks the camel's back with MS, which is really interesting because for years and years, many of us in the functional medicine community have known that going after infections can be really helpful for folks who have an MS diagnosis. So in addition to looking at Borrelia, looking at other possible infectious microbes, looking for mold toxicity, looking for heavy metals, pretty much all the things that can underlie other types of chronic illness can potentially be contributing factors when it comes to MS. And then the final thing I'll mention is that at a certain point in the treatment protocol, it can also be helpful to bring in agents that help with stimulating more nerve recovery and nerve growth. growth. So things like lion's mane mushroom at an adequate therapeutic dose. There's some interesting research looking at vibration plate therapy, which my understanding is one of the mechanisms by which that can be helpful is stimulating more growth factors in the central nervous system. And then there's different IV therapies that we can work with, like methylene blue and ozone and various things like that too. So there are quite a few treatment options. And again, for mild to moderately progressed cases, I've seen some really great benefits with for patients with an MS diagnosis. More severe cases, it's a bigger, tougher scenario to see much in the way of gains, but it's still worthwhile, in my opinion, to look at some functional medicine interventions to help augment their other conventional medical protocol. So I hope that this answered the question. If anybody has any outstanding questions on this topic or anything else, just post it in the comment section below, and I'll do my best to answer as soon as I can.